Hey everybody, and welcome to another video. So we are a homesteading channel, but for those of you who are new, you may not know that my day job is actually in nursing. So I've been a licensed registered nurse for almost a decade now, which is kind of crazy, but given the current events going on across the world and just the general uncertainty of everything anyways, I thought some of you might be interested to know what medical supplies someone who is in the medical field keep on hand for a worst case scenario. So the list I'm going to give today, guys, it's not completely exhaustive. I'm going to skip all of the common knowledge things like Tylenol and triple antibiotic ointment, things that I think everyone is aware that you want to keep on hand. And I'm going to try to focus on the things that I think if I wasn't in the medical field, I probably wouldn't know that these items exist, or I wouldn't know that they are available to be purchased by the general public. And everything that I'm showing in this video is able to be purchased without a medical license. In fact, most of the stuff I just ordered off of Amazon. And in the description box down below, I will include Amazon affiliate links in case you want to check any of these things out. We'll go ahead and start off with absolute worst case scenario. So these are potassium iodide tablets, and these are intended to be taken during a nuclear radiation emergency. So whether it's an accidental spill or intentional bomb, what these are supposed to do is protect your thyroid. So what's nice about these is they take a long time to expire. So these don't expire until 2032. So they last a long time. This particular brand, as always, you'd want to read the instructions on the particular pills that you get. But these do say that you can crush these and give them to children and infants. You just mix it up with milk or formula. So that's great. And also, these are extremely affordable. For a pack of 20 tablets, it was less than $15 on Amazon. So for this, it's a no-brainer for me just to have that peace of mind for less than 15 bucks. Absolutely. Next thing we're going to talk about is a book. So this is the Nursing Drug Handbook. You can tell this copy has been through some things. It's my copy from 2013 from nursing school, but I did keep it because this thing is just a wealth of information about medications. So you would look up the medication based on the generic name, and this thing just tells you everything you could possibly need to know. It tells you what the medication is used for. It tells you all the different dosages for all the different forms that the medication comes in. It gives ranges, like minimum dose to the maximum dose, and for how long to give it for both adults and children. And it talks about side effects and toxic reactions. It's just extremely valuable information in the event that there are no doctors around. So highly recommend this. And another nice thing about it is, since the FDA is constantly approving new medications, they have to update these a lot. So it's very easy to find very inexpensive, slightly older editions at used bookstores or online for very cheap. So definitely recommend everyone have one of these. And pretty much everything else in front of me is related to wound care. And I think I focus so heavily on that just because when I think about the activities that we would have to participate in order to survive, pretty much everything involves some risk of accidentally chopping something off. So I just feel like for us, that's probably the most likely injury that we would come across. And if we're in a situation where there are no ERs or antibiotics, I definitely want to focus on treating a wound correctly immediately to prevent an infection. So when I'm thinking wound care, my first priority usually goes to stopping the bleeding so your patient doesn't bleed out. So we've got a couple of things for that. First thing I've got here is called Bleed Stop, and it is just these little packets of this sterile powder. And it says it is for minor cuts to severe bleeding wounds, and it says it also works for people on blood thinners. And then I actually have two other things that I don't have yet. I actually just recently ordered them because I thought of them as I was thinking of this video. I will include screenshots of what I purchased. So the first thing is a digit tourniquet. So what that is used for is if I was to accidentally whack off one of my fingers and it's doing one of these numbers, that is a medical emergency. It does not take very long at all for people to bleed out. And so that is something that you want to get under wraps as quickly as possible. I think most people are aware that you can create a tourniquet out of things like a belt, anything to create that constriction that will slow down the circulation and slow down the bleeding. And any tourniquet is better than no tourniquet in a medical emergency. However, what I like about these digit tourniquets is if the only thing that I cut is one finger, I don't want to have to put a belt around my wrist and risk losing my entire hand. These are just meant to concentrate the constriction, and so there's less collateral damage. The other thing I ordered that I've not yet received yet is a surgical cautery tip. And it's like a little pen that supposedly gets up to 2000 degrees Fahrenheit, which is kind of nuts. I believe it said it only lasts 10 minutes though. I do not know if it's something that you can like get new batteries in and recharge it. I'd have to look into that once I actually receive it. But what I would use that for is if I had one of those injuries that was, you know, and I was at risk of bleeding out, I could use that to cauterize the blood vessel that got broken in the accident and hopefully prevent myself from bleeding out. It was also surprisingly affordable. I could only find it on Walmart, but it was only like 17 bucks. Now, if I have a big wound, I do not want to have to rinse it out with pond water or puddle water. So I always keep on hand lots of sterile saline solution. This particular brand is Neil Med Wound Wash. There's a couple different brands you can get though. You can get this on Amazon, but it's actually cheaper in Walmart or Dollar General. What's nice about this is it is pressurized, so you can really, you know, scrub the wound out with it, just the pressure of the water to get all the mud and nastiness out of it. So this is pretty inexpensive, and I like to keep several on hand. And depending on how severe and wide and how the wound is shaped, I probably am going to want to be able to close it so that it heals faster and there's less area to become infected. So I grabbed a couple of options for that. So we've got little butterfly closures here. These are not my favorite. It says they're waterproof. Not my favorite, but it is an option for smaller cuts. And then for big wounds, I wanted to be able to suture them up. So I bought this kit on Amazon. It comes with a little carrying case, and then inside there are these stainless steel tools. And it also came with several packets of sutures. And each of these packets, I don't want to open them up, but each of these packets is sterile, and it includes the needle and the suture, like the string itself. It's got several different types in there. They also included some sterile surgical blades, so that's nice. I wanted some additional sutures, so I did buy an additional box. This is a pack of 28, and these are both absorbable and non-absorbable sutures, so those are for different uses. But yeah, these are surprisingly affordable. So I'm glad to have these sutures on hand, but the con with them is there is a skill set involved in knowing how to tie the sutures. And also you have to have two hands to do those. So another thing that I bought is a disposable skin stapler. What's nice about this is you only need one hand to do it. So if I'm in a real bad situation where I'm by myself and I have to, you know, maybe fix my other arm, I could do this on my own. And also there isn't the skill set involved. It's very straightforward. You use it just like a regular stapler. Hopefully that's focusing. But yeah, these are a little bit pricey, but I'm still glad to have it in my kit. Like I mentioned before, preventing infection is going to be the name of the game. So a couple other things I always make sure I have is chlorhexidine solution. This is a antiseptic, and it is used to prep the skin of both the provider and the patient prior to like any type of surgical procedure to kill as many microorganisms as possible. Another thing I have a ton of are gloves, but all gloves are not created equally. However, a glove is better than no glove for sure. But we have just the boxes of gloves that are in there all loosey-goosey. Those are just regular gloves, which are very useful, and I'm glad we have them. However, it's also really important to me to have sterile gloves. So sterile gloves are different. They're more expensive. but you can tell they're sterile because they are packed in pairs in packages like this. So the inside of this package is sterile. And this is another thing where there's a little bit of a skill set involved, because you have to open the package and put these on in a very specific way to keep them sterile, because you don't want to touch the outside of the gloves with your skin because that would contaminate them. But sterile gloves, if you are potentially treating a really bad wound, anything where you want to prevent infection, sterile gloves are the way to go. Up next, this is lidocaine cream. I'm pretty sure this is intended to be used on hemorrhoids. I wanted to buy some injectable lidocaine, but I couldn't find it over the counter anywhere, so I just figure some numbing is better than no numbing, so I went ahead and grabbed this and tossed it in. Up next, we're going to talk about bandages, and I feel like in general bandages are a pretty common knowledge thing, so I only have a couple of things to say about them, but specifically for products like this rolled gauze, what I have to do is I have to remind myself that I need to take the amount that I think I need a stockpile of bandages like this, and I really need to multiply it by like 5 or 10. Because if I'm in an emergency situation, a situation of survival, I'm not going to be sitting in my warm, clean, dry home all day. You know, I'm going to be outside, I'm going to be with the animals, I'm going to be in the mud, in the muck, in the rain. And so it's going to be really important for me to be able to do regular, frequent dressing changes if I have a wound that I'm trying to prevent from getting infected. So I'm going to be going through this gauze like crazy. Fortunately though, the stuff is pretty inexpensive. My favorite place to buy this from is Dollar Tree. And actually I prefer the smaller rolls of gauze because each of these packs is sterile. And odds are you're not going to need that much gauze every time you do a dressing change. So it's better to have a fresh, sterile, pack every time rather than going through one large roll that's not sterile anymore. So yeah, we're up to our eyeballs in gauze. And up next on my list as far as bandages goes, that is a absolute must-have, is non-adherent pads. This I got off of Amazon. It's a 100 pack, 3 inches by 4 inches. As you can see, they come in just these little thin, sterile packages. They're individually wrapped. So what non-adherent pads are, they're a special material that doesn't stick to the wound. So wounds like to ooze, and I have seen the results of a wound that was just wrapped with like a rolled gauze like this without a non-adherent pad. And what ends up happening is when you go to change the dressing, all of the healed tissue and the scab that your body worked so hard to create the day before, it just comes right off with that gauze. So these pads, these prevent that. They keep it from sticking, and so you can change the dressing and you're not reopening the wound and, inviting more infection in, which is the goal. So these must have. Alright guys, that's everything I could think of for today's video. There will probably be a part 2 when I think of all the things that I forgot to include in this video. If you think I forgot anything, feel free to leave it in the comment section down below. Be sure to check out the description box for my affiliate links for all the items you see here. Thank you so much for watching. Be sure to subscribe and we'll see you in the next one. Bye.